what if I tell you that once in a while, but this is the first time almost in 30 years doing endodontics that I find out that this patient comes with a huge emergency, feeling pain in these two teeth. Two of them have the same pain. And I lecture so much in refer pain because I love the distinction between the two teeth, if the pain is in one tooth and maybe it's the other, and the challenge to find which one is the tooth is the most important. So we don't do a root canal in the wrong tooth. What do we do in these cases? A patient comes with extreme pain, cold, hot, constant, with everything. He couldn't handle it with anything. So when we did the endodontic evaluation, as you saw in the last cases that I was talking about, diagnosis with different cases, is we go with, how do you know you need a root canal? Well, we put cold test in each one of these teeth because I had to find out, remember which one is the tooth. And as I mentioned to you in the other chapters, it's important that we diagnose your whole quadrant. It's not such a thing, oh, this is the tooth, okay, I do the root canal in that tooth. It happens, but it's very important that we confirm that the tooth in question is the one, no matter how many years we've been doing this. And I said that because sometimes we can say, okay, this is the tooth, but it's not that tooth, it's this one, and vice versa. So we took our time talking about, after we took the care of the pain of the patient in the first time, we gave him a couple of weeks to be able to distinguish what will happen with the other tooth. And when your endodontist cannot find, because all of the symptoms were similar, the difference is in this tooth, when I was analyzing the x-ray, I was able to see around the old restoration the patient had a black area. And that black area was a cavity where bacteria was getting in. Why? Because the patient was grinding his teeth like crazy. He's a very famous writer. I adore this patient, but he was grinding his teeth. He was remodeling a house. He was in such a much stress that he was responsible to handle. He won awards. And in any case, I said, you need a night guard because this situation is gonna make it worse. So at the beginning, you have to wait, because if they make a night guard and then they make a crown or a new crown that he will need, then you're in trouble because that night guard is not gonna fit. They have to do a new one, or maybe the dentist can do an adjustment. The prosthodontist or prosthetic dentist, they are very well trained for that, but a lot of my general dentists that I work with, they do the same in the night guard. The night guard has to be very well adjusted. I don't do it, but if you don't take care of it, I tell my patients, I will continue doing root canal after root canal. And I told this patient many years ago, but until now, when he had the symptoms, he decided, okay, I'm gonna do something. So in a difficult diagnosis, this is what I've been presenting in the last part of the show, is you have another crown next to this patient. That's the challenge. This is a virgin tooth. When you look at this is your crown, this is your root, you follow a line, and in the middle is the nerve, and it's dark. But it's not normal when we see a shadow that doesn't, in a different type of x-rays, I compare the x-rays and I look, and no matter what angulation I took, I saw that shadow. Now, sometimes also some patients can have resorption, but root resorption doesn't give you pain. So when I find out this was the tooth, then we have to do the root canal in this tooth. I have to do a test with anesthetic, and then I put a little bit of anesthetic. This is an anesthetic test. It doesn't matter if I tell you the technique, but then I was able to find out that this was the tooth in question. We did the root canal. The patient was extremely happy for a couple of weeks. But guess what? The pain came back the same way that it was on the day number one, and I wanted to die. But I told the patient, which we're very good friends now, I know this patient for many years, I have done another treatment, that it wasn't his fault actually, it's another story that I will tell you. But in this case, the patient And I have an amazing amount of communication, and I explained to him that it's almost impossible that I ever in my endodontic career I have to do 2 root canals on the same quadrant because it was 2 teeth involved instead of 1. And this is the first one in my life that I can tell you with all confidence that after I check and recheck diagnosis, in reality this patient have the 2 teeth involved and the 2 teeth needed the root canal. But I did not want to do I don't want to do aggressive dentistry, of course. So when we finished this and the pain went away, but the pain came back in this crown. And this is a very old crown that I start opening and I start looking at the margins. But this is the same. He had a really good dentist, but then he started grinding and grinding and grinding his teeth to the point that then you start opening the margins, you start breaking the seal, and then bacteria start getting in and start getting slowly. So when it gets to the point that it's a huge inflammation, as I told you, if it's all this involved, but the crown doesn't let us see, then you're gonna find with the situation with extremely pain. And when I did a test of anesthetic, the patient and I find out that's the tooth, I did a root canal, and finally the patient was comfortable. But the bottom line in today's episode is I want you to learn this. If you feel like you are tightening your teeth when you talk, be mindful, be thoughtful. Say, okay, I'm doing tightening, do I doing this? Sometimes we have some certain ways. I have a very famous patient that I will present to you that he used to say that he was composing songs, and I love this patient to death. And he's in India right now, but he said he used to compose songs, and I didn't. I said, I don't care what you compose, but you're gonna destroy your teeth after I did a root canal treatment on him. So this patient was the same. If you don't put a NIGAR, I will not guarantee at all that you will have a good prognosis on this treatment. But sure enough, he's very disciplined. He came, he have his NIGAR, and he's happy. We're gonna see him in his year follow-up. We did a 6 months, the patient is very happy. If you have any questions, remember this. If you feel like you're grinding, or ask your dentist, do you think I'm grinding my teeth and I need a NIGAR? Because after his crown, he have his NIGAR in place and he uses it every night. If you have any questions to this topic, call, text, send me a message to the YouTube channel. Thank you.